Hospital facilities in Ghana often face congestions due to reliance on manual systems for accessing patients' health data. This not only causes delays in healthcare delivery, but in severe cases results in the loss of lives. Dr. Maxwell Entry, Country Director of Farm Access Group Ghana and Board Member of Healthcare Federation of Ghana, advocates the adoption of digital platforms by private health sector players.
What we need to build on are some of the issues around how do we innovate new ways of service delivery that takes advantage of the digital revolution and digital transformation that we have seen in the telco industry, that we have seen in the hospitality industry, that we have seen in the transportation industry. Suddenly, ride-hailing Ubers have transformed our environment. How do we see same models or similar models playing out in the healthcare sector? So that's one big bucket that we need to work on. The second one that we need to work on is how do we support the political class to make informed inputs into party manifestos that can help transform our health system. And here, private sector players can be neutral arbiters in providing research-informed, data-driven position papers, and have that discussion with political parties so that these can feed into political party manifestos.
First Vice President of the West African Private Healthcare Federation, Dr. Linda Ajuadeka, has however raised concerns about the current state of healthcare delivery in the country.
My biggest concern is about service standards, and in the time that the Federation is in existence and into the future, what I'm looking at is the Federation supporting providers to improve standards. This goes across from supply chain to the amount of time you spend in the consulting room, to the quality of service, to the quality of goods in terms of medical consumables. Give us access to affordable financing. Give us reduced interest rates for companies that require lending. It's only in improving access to financing that we can reduce the cost of care and improve quality.
Meanwhile, Dr. Samuel Donko, President of the Pharmaceutical Society of Ghana, has signaled its readiness to always partner with the private health service providers to improve the healthcare delivery in the country.
I think we have a very good relationship. We've always partnered with them, and we believe that with the Federation, it can only get better. And one of the things we expect is that there will be a lot of financial intermediation so that pharmaceutical suppliers would be able to recover their supplies, payment for their supplies on time. That's always been an issue with credit supplies, delays in payments. That usually affects capital, and based on that, a number of companies or pharmaceutical companies need to go out and borrow. When you borrow, you know the associated interest rate. So we believe that with all the financial institutions we heard from today, a bit of financial intermediation is what might help us to be able to do better.
The Healthcare Federation of Ghana is a country chapter of the African Healthcare Federation, which is affiliated to the AU, aims at promoting and enhancing medical care in Ghana with emphasis on the provision of affordable and accessible quality healthcare. Samuel Mbura, Joy News.